You probably added another pillow to your bed sometime in the last few years, without thinking much about it. The number of pillows you sleep with is one of the most sensitive signals your heart can send you, and almost nobody knows it. Your eyes, your ankles, your fingernails, the rhythm of your pulse, they're all communicating something about your cardiac health right now. 7 specific physical signs I use every day in my clinic to identify hidden heart disease. Signs you can check on yourself right now using nothing but your own eyes and hands. I'm Dr. Gerald Mark, and heart disease is something I diagnose and treat every single day, often by noticing details my patients themselves have completely overlooked. Roughly half of all American adults over 40 may be living with some form of undiagnosed heart disease right now. You could be one of them. The terrifying part is that it often whispers instead of shouts. Most people have small, gradual changes they interpret as normal aging, a little more shortness of breath on stairs, socks that fit differently, a pillow habit that evolved so slowly they can't remember when it started. I had a patient, Vivian, who came to see me for a routine checkup. She was 67, active, felt completely fine, but when I asked her my standard screening questions, the pieces of her story painted a very different picture. And that's what I want to teach you today. How to read those pieces before they become a crisis. When your heart struggles, it can't move blood through your system efficiently. Blood backs up, creating pressure in places it shouldn't. When that backed up blood sits in your lungs, fluid leaks out of blood vessels into lung tissue, like trying to breathe with a damp sponge inside your chest. When you're standing, gravity pulls that fluid downward, but the moment you lie flat, that fluid spreads throughout your lungs. So instead of lying flat, you add a pillow, then another. You're not being more comfortable, you're compensating for your heart's inability to manage fluid properly, and you might not even realize it. You feel that subtle weight in your chest when you lie down, and your body whispers, "Add a pillow." And you do, without ever asking why. Vivian was a retired teacher, 67 years old, still volunteering 3 days a week at her local library. She walked 2 miles most mornings, and considered herself in good health. She felt energetic. She had no chest pain. When she sat down across from me wearing a soft gray cardigan, her hands folded in her lap, the posture of someone completely at ease, by every measure she cared about, she was fine. But when I asked about her sleep, she mentioned she'd started using 3 pillows about 2 years ago because it just felt better that way. She said she could climb stairs, but needed a moment at the top. I checked her ankles and found mild pitting edema. When I pressed my thumb into her shin, the indentation stayed there for a few seconds. She'd attributed it to her shoes being tight. An echocardiogram revealed that Vivian's left ventricle was struggling. Her ejection fraction was lower than it should be. She had heart failure, and she'd been walking around feeling fine, completely unaware. We caught it because Vivian answered questions honestly about things she'd been living with for 2 years. If you haven't subscribed to the Healthy Habit yet, I want to ask you to do that right now and turn on notifications. You've just watched me deliver real, clinically grounded information that used to require a doctor in your family, and that's exactly what this channel is built to give you. Let's keep going. If you need more than 1 pillow to breathe comfortably at night, that's a sign worth investigating. Test it right now. Lie back. Could you comfortably lie completely flat and breathe normally? Or does your chest feel tight without that pillow? A landmark study in the Journal of the American College of Cardiology followed over 6,000 adults over age 65 for 8 years. The need for multiple pillows to sleep comfortably was an independent predictor of heart failure diagnosis, even in people with no other obvious symptoms. Tonight, lie down with just 1 pillow. Stay for 2 minutes. If you feel tightness or difficulty breathing, prop yourself back up, but pay attention to that sensation. If you've been gradually using more pillows, bring it up at your next appointment. Tell your doctor, "I've noticed I need multiple pillows to breathe comfortably lying down, and I want to understand what that means." Vivienne realized that night, after we spoke, that she'd never questioned why she needed those pillows. She just accepted it. That small acceptance had masked a serious condition developing in her heart. Your heart only shows real strain when it's being challenged. Right now, not tomorrow, right now, find a flight of stairs. Climb them at your normal pace. Notice how you feel at the top. Are you catching your breath? Do you need a few seconds to recover? A study in Circulation followed 5,000 adults and found that difficulty climbing stairs was one of the earliest detectable signs of reduced cardiac function. If you're unusually winded on stairs, or if this is new for you, that's a conversation starter with your doctor. Vivian told me later that she'd been attributing her stair fatigue to not being as fit as I used to be. But it wasn't fitness. It was her heart beginning to struggle. Look at your ankles right now. Do they look puffy by evening? Do socks leave deep marks? Press your thumb directly into the puffiest part of your ankle for about 20 seconds. Then let go. If a dent remains, that's pitting edema, fluid leaking out of blood vessels. When your heart isn't pumping efficiently, blood backs up and fluid leaks out. A study in the New England Journal of Medicine examined over 7,000 adults and found that new-onset peripheral edema was present in nearly 40% of undiagnosed heart failure cases. Tonight, check your ankles using this test. If you see pitting edema, especially if it's new, mention it to your doctor. Vivienne's mild ankle swelling, combined with her pillow use and stair fatigue, created a complete clinical picture. No single sign screamed heart disease. But together, they told a story. As you're watching this, which of these signs, pillows, stairs, or ankles, made you recognize something you've been living with? Drop that in the comments right now. I read every single comment personally, and what you share shapes the videos I make next. Place 3 fingers on the inside of your wrist, just below your thumb. Feel your pulse. Now pay attention to the rhythm. Does it feel steady and regular, or chaotic? Does it skip? Many smartwatches can detect irregular rhythms, which is helpful, but your own fingers can pick it up first, and they're always with you. If your pulse feels truly irregular, that's something to mention to your doctor today. Call your office and describe it. You may need an EKG. A study in Stroke Journal found that people with undiagnosed atrial fibrillation have 5 times higher risk of stroke compared to people with normal rhythm. 5 times. Check your pulse right now while watching this. Spend 30 seconds really paying attention. Vivian's pulse was regular. One piece of good news in her story. But I've had other patients whose irregular pulse was the first sign I caught of a serious condition. Right now, turn your head to the side and look at your neck in your phone camera. Then look at your thumbnails. Push them together. Do you see tiny pulsations in the nail beds? These could indicate a leaky aortic valve, a condition that places strain on your heart and can lead to heart failure. A comprehensive review in Circulation examined 40 years of research and confirmed these findings remain valid indicators of significant valve disease. If you do notice visible pulsations, that's worth mentioning to your doctor. For Vivienne, these findings were absent, which was reassuring. Her story was written in the pillows, the stairs, and the swelling, not in these more dramatic physical signs. Do the thumbnail test right now while you're reading this. Place your index fingers nail to nail. Push your thumbnails together. Do you see a small diamond-shaped gap between them? If that gap is clearly visible, that's normal. If the gap is missing, if the nails angle away in a more closed V shape, you may have clubbing. Clubbing happens when the body has been exposed to low oxygen levels for an extended period. Heart disease can cause this, especially in people with long-standing heart failure. If you think you might have clubbing, take a photo of your hands and show it to your doctor. Vivienne didn't have clubbing, but I've had patients whose fingertips told me their heart had been struggling for years without their knowledge. Go to your camera right now. Look at your eyelids in the light, inner corners, near the nose. Do you see anything yellow or raised? These are xanthelasma, cholesterol deposits underneath the skin. They're not dangerous by themselves, but they're a red flag that your cholesterol is abnormal and a primary driver of plaque buildup in your arteries. A study in Circulation found that people with xanthelasma were 3 times more likely to have significant coronary artery disease. 3 times. If you see yellow patches, ask your doctor for a comprehensive lipid panel. Vivian's eyelids were clear, but her cholesterol panel told a different story, another piece of the preventive puzzle. Working with patients exactly like Vivian, I put together something I call the Daily 7 Check, a simple way to take everything we just covered and turn it into something you can actually live with every day. The daily 7 check is simple: pillows, stairs, ankles, pulse, pulsations, clubbing, cholesterol deposits. You're not diagnosing yourself. You're gathering information. You're becoming literate in what your body is communicating. Once a month, check all 7. It takes 10 minutes. Check your pillow situation. Lie down with just one pillow. Notice how you breathe. Climb a flight of stairs right now at your normal pace. Notice how you feel at the top. Do the ankle test. Press your thumb into your shin. Watch whether a dent remains. Check your pulse. Spend 30 seconds paying attention to the rhythm. Go to your camera right now. Look at your eyelids, fingernails, and neck. Look for yellow patches, enlarged fingertips, or pulsations. Write down every sign you've noticed. Bring it all to your next doctor's appointment. Or if any sign is new or alarming, call your doctor's office today. Everything I've shared today is for educational purposes. Your own doctor is your true partner in this conversation, not a replacement for it. The pillows you sleep with signal fluid backing up into your lungs. Shortness of breath on stairs means your heart is working harder than it should. Ankle swelling is fluid leaking out because your heart can't manage the pressure. An irregular pulse could mean atrial fibrillation, dramatically increasing stroke risk. Visible pulsations could indicate valve disease. Clubbing could signal chronic low oxygen. Yellow eyelid deposits warn that your cholesterol has gone wrong. Vivian came to see me feeling completely fine, but by the time she left my office, she had a diagnosis, a treatment plan, and most importantly, she had time to address her heart disease before it became a crisis. By watching all the way through this video, you've done something most people your age will never do. They'll scroll past this without a second thought. They'll keep adding pillows and climbing stairs and feel winded and assume it's just aging. And years from now, some of them will find themselves in an emergency room shocked their heart was struggling the entire time. You're not going to be one of those people, not because you watched a video, but because you know what to look for and you're going to actually look. Share this video with your spouse, your closest sibling, or that friend you know you need to protect. Don't send it with alarm. Send it because you've just learned 7 things you can check, and you want the people you love to know these things too. Subscribe to The Healthy Habit and turn on notifications. You'll get videos every week built on this same principle. Practical, medically grounded information you can actually use to build the next decade of your life. Which of these 7 signs surprised you most? Or which one made you recognize something you've been living with? Drop your answer in the comments. The pillow you add tonight to sleep comfortably is not a small decision. It's your body's way of protecting itself. The question is whether you're going to listen. Small choices, made aware, are the most powerful medicine your body will ever receive. I'm Dr. Gerald Mark. Make one of those choices today, and I'll see you in the next one. Everything I have shared today is for general informational purposes only, based on published research and clinical observation. It is not a personal diagnosis, and it is not a substitute for care from your own doctor. Please consult your physician or a qualified healthcare provider before making any changes to your medications, diet, supplements, or health routine.